I'm Jess Maritt and welcome back to episode 2 of Back in a Mill. On this episode, we will be discussing some myths and facts of the industry.
Is it true that you can earn a six-figure salary in the first year?
This is a question that I get asked a lot, particularly by students. So, whereas it's not impossible to earn that six-figure salary within the first year, it is quite difficult. And what I tend to say to my students is if you already have an existing client base, earning that six-figure salary is a bit easier. And also it depends on how much experience you actually have within business. So if you don't have a lot of experience within business, maybe you've never run your own business before, it is again slightly more difficult. And I think that wrongly at the moment, there is a perception where training academies will try and push the fact that you can earn this. And as much as I believe that you can earn that and more, it is quite difficult to earn that in the first year. I definitely didn't earn that in my first year, and I had business experience, but what I didn't have is I did not have an existing client base. So again, that's where I struggle to earn that salary. I think definitely some tips if you haven't ran your own business before is you would need one, look for a relatively good accountant. They will be able to help you and advise you on how to set up. And another tip for if you've not ran your own business before, try and access online coaching for business fundamentals, or if you have someone in your family that set up a business, speak to them and get some advice and things will be a lot easier for you. I think as a new practitioner, you are up against a few different challenges at the same time because you are up against actually going at it alone, which can be scary, especially if you are coming from a job where you are used to a regular salary. So with a regular salary, you can expect a certain wage week after week. With aesthetics, you can have really, really busy weeks and then you can have very, very slow weeks. And I think that is something that is challenging for new practitioners that aren't used to that. But again, I think just stick to it, be persistent, and don't be worried on those quiet weeks that you're doing something wrong. Sometimes it is just the way of the business, and I would definitely encourage you to try and be as productive as you can in those weeks where you're not so busy. So if we're having a bit of a quiet week, we'll definitely look at marketing strategies, we'll look at business plans, we'll look at some goals that we've set and actually just realign those goals. So don't waste the time, just really try and go, okay, we're not taking as much this month or we've not had as many clients in. Do we need to perhaps put on an offer? Do we need to do a promotion that's going to encourage the clients through the doors? Is everything okay on the social media? It gives you a chance to really reflect and evaluate on everything that you're doing. And within any business, reflection and evaluation are two key points in order to make sure that you are succeeding. I think also that if you have a business and you are not checking correctly what your ingoings versus your outgoings are, that again is another struggle because you never actually know how much money you are making. So always make sure that you're doing exercises where you go, okay, this is everything I had to spend out this month, whether it be stock, insurance, anything that you've done on your premises that you might have upgraded. Make sure that you know what those outgoings are, what your incomings are, and then work out your profit margins. And this is also a really good way of monitoring progress. And it might be that you do this exercise, for example, in January, and then in March, you can actually see that you've actually took more, or actually I took less. And what you can do by actually performing those financial checks is you can actually check your performance year on year. So to give you an example, you might notice that January was pretty quiet and you might really worry about that you did something wrong. But then next year, if you do the same exercise and January is also quiet, you have spotted a trend. So you know, okay, I've done this twice. I've done this 2 years in a row. January has been quiet on both occasions. Therefore, I know that January is a quiet month and I'm going to do more in December to make sure that those profits are increased. That is definitely majorly important for monitoring your income. So if you are a practitioner and you haven't hit those 6 figures that you keep seeing everywhere on Instagram, do not worry. I didn't hit 6 figures either, and it is very difficult. Like I said, not impossible, but definitely difficult. Don't let it dishearten you, and you'll definitely see some more returns on your investments within your second year, because within that second year of trading, you're not actually having to do as much of an output, because when you first set up is when you'll definitely see the majority of your investment. So do not worry. Keep going.
Being in the industry can look so glamorous. What is your opinion on this?
So my opinion on the aesthetics life and glam, I think days will differ, and some days it is quite a glam life. You know, you can kind of set your own hours, so you're not rushing around on someone else's time schedule. This is the great thing about becoming self-employed and taking control of your own life. You can set those hours, so you can turn up at 10 a.m, get your Starbucks. That's definitely what I do, and if you're a client of mine, you will know that I'm here every morning with a Starbucks. So that is definitely what can appear the more glamour side of things. You can go home if you've got children, you can go and collect them, and you're not kind of having to work ridiculously long hours. And that is definitely very nice and the more glamorous side of the job. As far as I'm concerned, I think when you get to a certain level within your clinic and you are offering not just a few treatments, but you have actually a wide array of treatments that you are providing as a service, I think that's when things get less glam. For anyone that has been to me within the last 6 months or so, we have been performing a lot of the non-surgical BBL enhancements. So for those of you that might not know what a non-surgical BBL enhancement is with filler, so this is non-surgical. This is where I actually place fillers onto the hips and into the glutes to give you a better projection and a more rounded, Kylie Jenner-like figure. When I do a non-surgical BBL, I am not glamorous at all because it is quite difficult to be able to get an amazing shape with your head up straight. So my head is literally down on the floor, upside down. If you saw me, you would think it was so funny. I'm just on the floor. It's so hot because I'm having to concentrate on what I'm doing. And we also have to adapt the temperature of the room to the client. So you can imagine I have a client that's naturally very cold and she's freezing and bless them, they can't wear their trousers. They're just in their underwear and they're cold. I'm in full scrubs on the floor trying to push through. For those of you that haven't seen the syringes for the non-surgical BBL, they're huge 10ml syringes and the product is very thick because we have to have a thick product to make sure that the filler is going to last and it's going to sit properly anatomically. So I'm trying to push through with a 10ml syringe, a very thick product, and it's not rare that I will need to push through around 400 mils of product. Sometimes, that's a very long day and we can be doing a non-surgical BBL for up to 6 hours because it does take that long. So you can imagine pushing through 10ml syringes for 6 hours becomes very tiring. So that is definitely not so much of a glamorous treatment to perform, but the client always looks absolutely great afterwards. So it's well worth it, but definitely not the most glamorous side of the job. The other side of this role that's definitely not glamorous is because I am going abroad a lot to inject. I'm going to Spain and I'm injecting within those clinics there. I see a very high volume of ladies, men to come in and have those treatments. So at the end of the day, because you are very repetitive with filler and you hold the syringe in a certain way, so when you're holding that syringe, your hand almost becomes locked in that position. For anyone that's already practicing, you'll know exactly what I mean. And your hand almost gets stuck like this. And you're just like, you have to almost kind of crunch your fingers. That sounds disgusting. You have to almost crunch your fingers out to kind of get that stretch. And this is something that I'm really struggling with at the moment, actually, because I've been doing this for so many years and I've been so repetitive with this movement. My fingers are actually becoming very, very sore. And this is something that I'm having to actually see the GP about at the moment. So definitely not so glamorous. Again, just part and part of the parcel of the job.
So do you think that there is a misconception that this job as being a practitioner is easy?
I 100% think that there's a massive misconception at the moment that this job is easy. And I think it's definitely something that we all experience and that we all definitely hear being said, oh, this must be so easy. But what clients don't always understand is that we actually aren't just doing one injection, and it seems very quick for them because, as we all know, Botox is a fairly quick treatment. Dermal fillers are also fairly quick treatments. So from a client perspective, they might perceive that to be very easy. But what the client doesn't see is the hours and hours that we've worked on anatomy, the accredited qualifications that we've had to do that have taken absolutely months, if not years in some situations. We really are offering these services as experts within our field, and we are not offering these services as people that have been on a course for a day and we're saying, okay, we've learnt this very quickly and now we can offer you this service. We know that there are, unfortunately, people out there at the moment that are operating like this, and I think, again, I won't touch on it too much within this episode, but that's where industry regulation will come in place just to ensure that everyone is working to the same standard. And I think that once regulation does come into place, this will make this whole subject much more easy and actually will make things a lot smoother across the board. And I think that will result in things like less client complication, better outcomes for clients, and definitely better results and better aftercare. So I personally am very excited for regulation to be within this industry, but as we know, it's not quite here yet. So going back to the point on the misconception of whether this job is easy, I think what I would really like to kind of reinforce is that the clients are paying for the skill and not the mill. And by that, they are paying for your skill to inject that safely and so that they have the best results possible. So I think those are really big reasons why this is not an easy industry. And I think the responsibility that we take on as practitioners can take its toll, especially if we're seeing a lot of people during the day. I think that we mentally take on a lot of challenges that maybe the client doesn't always realise that we're doing. We're having to constantly do administration and make sure that we're logging client befores, client afters. We can't miss anything. We can't miss paperwork. We can't miss those in-depth consultations. We can't miss making sure that they're okay that evening. So it's definitely not an easy job to be in because it never stops, and you're not providing a service in which that client will receive the service and they leave and you don't see them again. You are offering that client an ongoing service for the day after that, right up until they are fully healed, which can in most cases be 2 weeks. So we definitely take on a lot within our roles, and I think that that's to be highly respected for anyone that isn't already within this industry. Another aspect of the role that definitely means that it's not always easy for us is, I think, because you don't just have one injection pattern for everyone. So this is definitely not a one-size-fits-all industry. So, for example, you have a male patient, he will have a completely different pattern anatomically to a female patient, or you may have two female patients that present very differently in the sense of they might have very different anatomical responses. So we're having to constantly change those patterns and tailor it to that client. That takes time, that takes practice, and that takes a very, very in-depth consultation Is this their first time having the treatment done? How did they respond before they had the treatment? Did they go to another doctor, nurse, practitioner? How was their reaction? How was their response? We're constantly having to monitor these questions to find out the answers of how to actually move forward with our injection patterns. And I think that whilst we're trying to do that, we're also trying to manage the expectation of the client. So I think having to do these things together can be a challenge, because not only are you thinking about that, you're also thinking about something else. And the client expectation and the client outcome is the most important thing. And if we miss steps within any of those prior steps, then their client outcome is not going to be optimum. And that's what you should all be aiming for: optimum results, optimum client satisfaction, and that will result in your client returning for further custom.
What do you think is the biggest misconception from a client's point of view?
I think from a client point of view, clients definitely worry that if they have filler, that they're going to look like a completely different person. And I understand this totally. We have all these platforms now like TikTok and YouTube, and we do see some scary things, and we definitely see some scary results. So I think clients see these things, especially if they're not within this industry and they're not a part of this world already, and they assume that they're going to literally leave looking like a different person. And I think that's a massive misconception, because if they could kind of understand more how much filler we're actually using and how we can tailor that filler to look natural, they would be so different and so much more comfortable. But I think, again, this is our job as practitioners, is to educate clients. And for any clients that are watching this now thinking, oh my God, that's me, that's how I feel, come in, have a consultation with us, with your practitioners, where you might be viewing from, and talk to them. Say, I would like to do filler. Maybe you're thinking about having a package treatment. How many mils do you think I should have? And ask them to explain to you in a way that's appropriate for you to understand, okay, this isn't going to make me look like a different person, but it will improve the way I look, and I will still look like me. And I think this is massively important. And if you do go to a practitioner and they're not using words like natural and enhance, then that is a little bit red flags for me personally, because you shouldn't be wanting to do this to look like a completely different person. You still should look like you, just an improved version. And I think that's really important. And it's definitely an ethic that I have as an injector. And I think that that's a lot easier for clients to make them informed decisions if we can manage the expectation of, okay, 1 syringe will do this, 2 syringes will do that. And actually, we can go up to 4 or 5 syringes and still make you look very beautiful, very nice, and you won't look like you've had a lot of filler. Again, the trick in this industry is definitely having that skill to be able to do that and to place the filler strategically in the best way possible that suits your face.
Will I be judged by my friends if I get fillers?
No. I think if you have friends that are understanding that there's something about your face that you would personally like to change, I think that your friends should be definitely coming from a more supportive point of view. And I think this is a worry, especially for the younger girls and for the older generation, because younger girls are always concerned that maybe they're the first one in the group to try a filler. They are worried that they will be judged by their friends as, oh, you don't need it, or, oh, why did you do that? But these are all very personal choices that we make as adults. So I think if you surround yourself with friends that are understanding, friends that are supportive, you will feel a lot better about making those decisions. And at the end of the day, anyone that has anything done as an enhancement is a confidence boost. So if there's a confidence boost that you're happy with, you've done your research, you've checked to make sure that you're happy with absolutely everything, and you're still feeling confident to go ahead, then I think that's pretty good. It's a pretty good momentum to say that, okay, yes, I do want to have this treatment done. And what I always say to my clients, if I either feel that you're not sure or I'm picking up that you're nervous, I will actually exercise a discretionary period where I say, okay, let's just call off. And if you're still wanting this done in a week, then we'll go ahead. And if I recognize that you are hesitant, not sure, haven't quite decided, I will put off your appointment until another week. And it's not because I'm being mean or I don't want you to have it done. It's because I want you to be sure that you're making the best informed decision for you. And any practitioner that you see should be doing that as well. And I think if you have that extra week to think about it and you decide, actually, I'm not quite ready, that's fine. We would rather that you weren't ready, went away and then came back at a later date than you did something that you weren't comfortable with. So definitely for younger girls, I would say this is the most common age group for this kind of feeling. And being judged by friends, especially if they're the only person within their friendship group that has gone ahead with a treatment that is non-surgical. With older ladies, I think because the fillers and Botox side of things has been a very new generational aspect, I think that they also can get a little bit nervous. Oh, okay, but I don't want to look too young or like I'm trying to be too young. The thing that we need to remember and that clients that are a little bit older need to remember is it's regenerative. So everything we do doesn't have to be extreme. It can be very natural. We can use a filler to do a little bit of plumping in an area that maybe you've just lost natural collagen. Or we can do a skin booster, which offers no plumping at all if you're, not really wanting that look. We can do a skin booster that's more rejuvenation, more fine lines, and it's very, very natural. Or you can opt for a polynucleotide, which is not a filler and it's also not a skin booster. It's classed as regenerative, so it's regenerative medicine that's been tested since the 1970s as helping with age spots, melasma, micropigmentation, acne scarring, loss of volume, elasticity issues. So again, we have lots and lots of different ranges of treatments that are suitable for absolutely everyone. Please don't be worried to come into us, have a chat, come for a consultation. We will only ever do something that we feel is within your limitations and is within something that you are also comfortable with.
What advice would you give to practitioners on a day-to-day basis?
I think on a day-to-day basis, there's small things that you can actually implement within your practice that will really help you to plan for the day, have a successful day, and to feel like you've really accomplished the goals. So I would say top tip here is definitely getting deposits from your clients. Anyone that operates and that doesn't take deposits will know that it's very difficult to get your client to always turn up if they've not left a deposit. If your client is committed to leaving something of monetary value that they know that they will lose if they do not attend, you'll be very surprised how much they will try and get to that appointment. Whereas if they've not left a deposit, they kind of wake up that day, maybe they had every intention of coming, something came up and they'll just say, hey, can I move it? And even though you can move it, you could have got another client in that spot. So I think from a business perspective and from your profit margins perspective, you don't want to have these gaps just because people have changed their mind or they want to come a different day, because that creates chaos. So for me, client deposits is an absolute must. I do not let a client book in if they have not left me a deposit. So I say, please, if you would like the appointment, please leave a deposit. Once that deposit has been taken, they're in the diary. We do allow a discretionary period of so that we can manage if there's a certain time frame for them to say, oh, on Thursday I can't come. That's fine, because you can manage that appropriately. But if you're just sat there waiting for someone, it's very frustrating. So definitely take your client deposits. That's a massive one for me. Definitely make sure as well that you are putting the correct space between clients. There's nothing worse than feeling like you're overrun. I mean, it does happen. We can't rush our jobs and you can't rush perfection. and this is what we can't do. But what we can do is just manage the diaries a bit easier. If we know we have a client in that might be a little bit difficult or a little bit more of a challenge, just allocate an extra 10, 15 minutes for that client. You also don't want to have an overly busy waiting area. So again, just making sure you've got the proper timings between your clients will also make you look a lot more professional than if you're running very, very behind. And I know it's not always avoidable. Sometimes you'll see a client and you'll end up spending more time, but wherever possible, just try and run those diaries as well as you possibly can. Also, always make sure that you have additional stock within your clinic. If you have a client that wants to do a different treatment that maybe perhaps wasn't discussed prior, it is quite frustrating for the client that they have to come back if you don't already have that product in stock actually within your clinic. Fair enough, you might not have an appointment straight away for them. It might be that you say, oh, that's perfect, we can do that treatment for you, but can you come back at the end of the day? Just make sure that you do have plenty of stock in case you are upselling any of your treatments, and you avoid client disappointment, and you will actually encourage repeat business because those clients feel like you're organised and that you have everything that you need for that day. Also, might seem very obvious, but make sure that you do have your emergency kit to hand. The last thing that you want running a clinic is to have an emergency and you haven't used your kit and you either can't find it or you don't have everything in there that you need. Make sure before you start your day that you know exactly where your emergency kit is. Make sure that it's stocked up with everything that you would possibly need for that day in case of an emergency. It sounds very straightforward, but imagine if you had a client and even though you don't have emergencies, that you have one that day. Just make sure that you do know where it is. Also, your Instagram socials. So this is my last piece of advice for this episode. So your Instagram post should always have a purpose. And this is something that I learned from myself. So we used to post Instagram content because we did a good set of lips or because we had an amazing Botox result or a client had a very nice overall result from a package, for example. But you have to post content with a purpose. You can't just post it to post it. So plan the content and always ask yourself, does this post have a purpose? Is there something that I want to achieve from posting this? And I think if you can do that, you'll be surprised how many bookings that you do get from your socials, because I learned from my mistakes here. We would just post a post and we were just not getting the bookings in that we should have been. And actually, when we planned the content and we planned the content with a purpose, we really did notice that those bookings increased. So 100% plan your Instagram posts or whatever platforms you're using, Facebook, with a purpose. Thank you so much for watching episode 2 of Back in a Mill. I've, as always, really enjoyed talking to all of you, and I hope that you found this episode helpful. If you do have any comments, please feel free to leave a comment, and we will see you in the next episode.